Welcome to Nasdaq Trade Talks. I'm Jill Malandrino, Global Markets Reporter at Nasdaq. Joining us for this segment, we have Craig Radley, Vice President of Client Services at MD Analytics, a global provider of healthcare and pharmaceutical market research solutions. It's great to have you with us, Craig. Welcome to Trade Talks.
Thank you very much.
All right, and tell us more about MD Analytics and clients, how they use your research.
Yeah, absolutely. So MD Analytics is a US and Canada-based research firm. We work with big pharma, small biotech, medical device clients to provide custom research solutions, as well as syndicated studies to support our clients' business and marketing efforts. So our studies typically source data using survey research or direct one-on-one interviews with healthcare providers themselves, with patients, or with healthcare administrators to help answer those business questions.
And as January is National Biotechnology Month, for this segment, let's focus on COVID's impact to healthcare service providers and patient interaction. How did it change patient activity, and what does this mean for providers?
Yeah, absolutely. So throughout the pandemic, we've been monitoring the impact of COVID-19 on physician practices to better understand how it will affect pharmaceutical and medical device companies. At the start of the pandemic, we saw patient volumes for non-urgent medical needs drop to near zero as offices closed and lockdowns were put in place. As time went on, the easing of restrictions and the boom in telehealth led those numbers on a steady recovery. However, the industry is yet to fully return to pre-COVID volumes. In June of 2021, patient volumes were still 19% below standard, and that has only recovered to 16% below standard by September of 2021. We also continue to monitor fewer patients being newly diagnosed with medical conditions. Presumably, the incidence of most diseases in the US population has not decreased, which implies medical conditions across the US are being underdiagnosed and undertreated compared to pre-COVID landscape levels. This is likely going to result in a rebound effect as these laggard conditions are diagnosed and treated in the future, and could slightly boost pharmaceutical and medical device interventions for a time. But there's still some uncertainty around the timing of the rebound, the effects of the new Omicron variant, as well as the time it will take for some of the patients to re-enter the healthcare system after dropping out of it, are still unknown at this time.
And that's really where the concern is, because people are getting treated later stages, unfortunately. And of course, you have the cost factor in as well. That's a derivative effect of that. How did COVID impact interactions with patients, and would a fully vaccinated population have made a difference?
Yeah, so we've conducted several studies that show physicians are much more comfortable seeing patients through telehealth than before the pandemic, and that they've broadly increased their use of telehealth over the past 2 years. But the use of telehealth declined from June of 2021 to September of 2021, and physician-patient interactions trended back towards in-person. In an ideal scenario where the population was fully vaccinated, physicians report they would see patients in nearly the same mix of in-person and virtual appointments as prior to the pandemic, when telehealth accounted for just 7% of interactions. This is a change from previous surveys conducted earlier in the pandemic, in which physicians were expecting the increased use of telehealth to be more permanent.
Interesting. So do you think virtual provider care is here to stay?
Overall, yes. The data indicates that virtual interactions will continue to play a role in medicine, but the utilization we've observed during the pandemic is unlikely to persist. As we observe similar trends in how physicians are interacting with pharma and med device representatives as well, here the recovery is slower, and in-person makes up only about half the volume of industry provider interactions that it used to. So in a fully vaccinated or potentially fully inoculated population, virtual will continue to play a role, but platforms like video conference and chat applications are replacing email more than they're replacing in-person meetings. And this is important because in-person interactions are generally considered the best for sales force effectiveness. So as we recover, we expect in-person will return, and the shifts in virtual interactions will likely have little to no negative impact on Salesforce effectiveness when compared to pre-pandemic measures.
Interesting. All right, Craig, we appreciate the insight. Thanks for joining us on Trade Talks. I'm Jill Malandrino, Global Markets Reporter at Nasdaq.
Thanks for having me.